Certain fundamentals that you need to know if you are going to live pain-free. And by the way, you absolutely can live pain-free. Number one cause of disability in the world is back pain, and it's solvable. And you know what? Quite frankly, it's not that hard to solve. So, today I had a couple of phone calls and these questions came up, and I thought, you know what, this is a fundamental. This is very important. I want you guys to know this because the more you know, the better your results and the less likely you are to have your pain come back. You do not need to live in pain. So here, why my back pain keeps coming back and why did my surgery fail? We get a lot of failed surgeries in our program and in our clinics, and there's a reason, because surgery doesn't fix the problem. It might make you feel a little bit better temporarily, but it does not fix the problem. And these are kind of the same. It comes back for the same reason that it failed, because you're not addressing the issue. Education is the most important, because when you have bad information, you make bad decisions. And you know what? It's the bad information actually leads to weakening of your spine and your muscles, which lowers your capacity to handle loads. And the inability to handle the load is why you have back pain in the first place. And that's why it keeps coming back. So there's three goals. Three very important goals. Number one, you need to manage the damaged tissues, which is the disc, through healthy movements. So you have to move in a way that's healthy for your disc so you can manage the pain, because it is the damaged disc that causes you the pain, or the damaged joint, but it's the same thing. So really what you need to do is you need to avoid uneven, meaning that the load is out of balance from the way you sit and the way you move. One angle, the angles are off. It's not symmetrical. And you need to make sure that you don't have excessive load and or repetitive disc load. So it's all about the load on the disc. Is it uneven? Is it too much? And is it too often? Bending. That's what leads to the back pain. So you need to manage this. You need to manage the movement patterns. People don't do that. And then here's what happens. You start to feel better, but that doesn't mean the disc is healed. So you have to give the disc enough time to heal. You want these tears in the annulus, which causes the bulge and the degeneration and the herniation, to heal. Tissue has to form in the area. That takes time. Discs take a long time to heal because they're avascular. They don't have a blood supply. So it requires a little more time. So you have to manage the load, you have to manage the movement patterns, and you have to make sure you have enough time. And then along the way, you have to increase your capacity, your strength, okay? Not necessarily in your bicep, okay, in your back, your hips, and your shoulders, and your core. You have to restore the strength. You have to increase your level of capacity, your level to handle the load. How much load can you handle? So when you fail at any of these three, pain's going to come back. It's the failure of these three that causes the relapse. Now this takes time. Okay? This red line is pain. This white line is functional strength. As you restore functional strength, you restore the balance to the tissues. You increase the capacity. Okay? I have on here 16 weeks, but it could take longer than that. Depends how long you've had the problem. It depends how bad the problem is. Some people it's 2 months. Some people it's 3 months. Some people it's 6 months. Some people it's a year. But you know what? A lot of you have had this for 10 years and you've tried everything and it's not gotten better. Stick with it for a year. This is why everything else fails. This is me. I have a degenerated disc. Severely degenerated, bulging, herniated, even a little bit of stenosis. This disc should look like this disc. It doesn't, because I jumped off a cliff and I damaged the tissues and I had pain for 10 years. Okay? So there's a certain way to manage this. Now, this is fusion. I did not get fusion, but what they do is they put screws into the vertebrae to hold the vertebrae together, and really it's designed to prevent motion. Okay? The goal of the fusion is to prevent the motion here, because this is where the pain is. It's in the disc. Well, guess what? If all you do is fuse this, and you haven't solved the first three, the goals that we talked about, which is really a 5-step process, if you haven't resolved that, what happens? Pain comes back. Why does the pain come back? Because nobody ever taught you how to move, so you're not moving very well. Even though this disc is fused, you might feel better, but what happens now when you're moving wrong? This disc starts to break down. Anytime you degenerate, have a fusion, and you have a degenerated disc, the disc above it after the fusion breaks down 4 times faster. Why? Because nobody taught you how to move. You're not moving well. The spine is still unstable. You're not creating any strength. The glutes are very weak. We talked about that video yesterday or 2 days ago, whatever that it was. And you have poor motion. And then the muscle compensation. Everything goes out of balance. So if you don't restore these things and achieve those 3 goals, proper movement, healing, and then functional capacity, if you don't restore that, the pain always comes back. So what do? What's the whole idea behind the program? And the one thing I didn't mention is this is what causes back pain. These are the 5 causes. Okay, these are the 5 causes. You restore that back to normal, you can get your life back. Now, again, it doesn't matter what you call it. You can call it a herniated disc, bulging disc, a degenerated disc, stenosis, and sciatica. Doesn't matter what you call it. It's all the process of the breakdown from the load on the disc that causes the disc to break down. If you restore healthy movement patterns, if you restore stability, if you restore endurance, and you restore primary motion to the hips and shoulders, and then the functional strength to the hips and shoulders, the problem goes away and does not come back. The only way to do that is to make sure you move well and you have the symmetrical strength, which is where stability comes from, and you have endurance, and all the motion patterns are in the best proper movement patterns. So it means it's functioning and moving the way it should. This is why if you don't restore this back to normal, your back pain comes back and your fusion fails, or your discectomy, or your laminectomy, or your microdiscectomy. So what's our motto? Pain relief is weakness leaving the body. When you restore these 5 steps back to normal and you create the strength, the pain goes away. But if you don't, the pain will come back. That's why when you get a passive therapy, when you get a massage or a manipulation or a stretch or electrical therapy or a laser or an injection or a surgery, that the pain comes back, because none of those have restored function. None of them. Those are passive therapies. Passive therapies will fail you because you will get weaker, or you'll rely on the passive therapy. Oh, I need to go get a treatment. Our goal is to teach you how to strengthen the spine. Our goal is to give you control. Our goal is to give you your life back. It's possible. Again, pain relief is weakness leaving the body.